Hey, good afternoon, everyone. So we are, I'm sorry if there's a bit of an echo in my end. In fact, I'm just going to check in the group, actually. Give me a minute. No, it sounds all right. Okay, it's just me having a moment. I've got to let go of the echo. Right. So good afternoon, everyone. We are joined by the amazing Dr. Helen. It feels like I had to introduce herself. She's also my supervisor, so I'm really excited to have her here and that you can meet her. And we're just going to do, well, I say we, Helen's going to talk about anxiety, what it is and the different types and some practical tips to go with the work that we've been doing on anxiety off and on in the last couple of months. So welcome, Helen.
Thank you, Steph. Good to see you. I can't see everybody else. Is that normal?
Yeah, so basically we would go live in the group and people will watch it at different times, so that's okay. So we may not see comments or anything, that's fine. Can you just do a little intro about who you are and a bit on your background, please?
Yeah, so I'm Dr. Helen Bellfield. I'm a Consultant Clinical Psychologist. So I have been qualified now for 25 years, I realise, which went very quickly. My specialist subjects are obviously mental health, and specifically addiction and trauma are my two main areas of practice. So I've worked in addiction for 20 odd years, and currently I provide clinical leadership to a school for children and young people with trauma, and work part-time on my husband's farm. So if you can hear background chainsaws and noises, that might be me.
It's actually me today as well. I've got somebody chopping it. They're not chopping my tree down because I wouldn't want my trees chopped down, but somebody's chopping a tree down next door. So yeah, might be all sorts of background country noises. Thank you, Helen. Okay, let's get stuck right into it. How would you describe anxiety?
Well, in its broadest sense, anxiety is something which causes us discomfort. That could be physical, psychological, or in terms of our behaviour. So when we think about anxiety attacks, panic attacks, or feeling anxious, it's a very physical experience. We think about the heart pounding, shortness of breath, feeling dizzy, maybe sweating, headachy, dry mouth. For some people, lots of sickness, maybe diarrhea, muscle aches and pains, real psychomotor restlessness, not able to sit still, not able to relax. So it's a very physical experience, often accompanied by a racing process of thoughts, an infernal soundtrack, worrying about maybe something specific, or maybe feeling something catastrophic is going to happen, feeling irritable, feeling on edge, sometimes feeling really tired, it may be a bit indecisive, can't decide what to do with yourself, can't make your mind up what to do. It really affects memory, affects sort of ability to concentrate on things. So it's very overwhelming physically and psychologically. And then, of course, that has an impact on behaviour. And the most common behaviour when we feel anxious is to try and avoid it, try and avoid the thing that's making us anxious, thinking, if I don't do that, then my anxiety will reduce and I will feel better. So the physical and the psychological symptoms of anxiety have a huge knock-on effect in terms of the way people then behave and the things that they feel able and confident to do. So that's like the headline of all forms of anxiety, I would say, manifest some or all of those symptoms. It can be different at different points in time. For some people, some particular bits are very overwhelming, and for some other people, it's a whole mass of those things together. If we are kind of looking into it a little bit more in terms of diagnosis or from a mental health perspective, there are quite specific and different types of anxiety. Do you want me to talk a bit about those, Steph? So,
yes, please. Sorry, I have my mic muted.
Right. the headliner really is that sort of what we call generalized anxiety, which people would experience many of the things that I've just talked about. And it's characterized by people feeling constantly on edge. Lots of things provoke anxiety, some small things, some big things, and sometimes nothing in particular. There doesn't seem to be a reason for it. And when we look at the research literature as to what causes anxiety, the overwhelming response is we actually don't know. There are some experiences in life which can create anxiety for us. There are potentially some genetic predispositions, but there isn't one thing other than being female which predisposes people to anxiety more than others. So for women are twice as likely as men to experience an anxiety disorder.
Oh, right. Why is that, Helen?
Well, again, we don't really know, but we suspect hormones play quite a big part in that, because as women, we have a constant state of ebb and flow and flux. And I think most of us can recognise that there have been times in our own hormonal journey when we felt much more anxious than others. And that could be happening on a monthly basis as we're cycling through our monthly hormonal pattern, or that could be happening across the lifespan as we enter and leave having a menstrual cycle. So those seem to be particular times where women are more likely to experience higher levels of anxiety. But we do know overall women are twice as likely as men to experience anxiety.
Oh my God, women, like hormones and everything, and then mental health on top, blimey.
And how much those two things interact, conversations you and I have had quite a lot, Steph, about actually, I think it's been under-researched in the literature, is what the impact hormones are upon our physical and mental well-being. So moving away from general, which is, it could be anytime, any place, anywhere, we've got some quite specific forms of anxiety. So we've got social anxiety, or often known as social phobia, and we're talking about, lots of us feel really bit nervous if we're going into a situation where we don't know people very well, or for many of us at the moment, nervous because we haven't been among people for so long. So even seeing people that you know really well can make you feel on edge and slightly anxious. A social anxiety at its diagnosable level would be, it would impact on somebody in a way that they couldn't freely live their life to go into social situations, and that might be with known people as well as unfamiliar territory. But it's very specifically related to social interaction. It doesn't happen spontaneously at times where there isn't a connection to needing to be among people. It's very specific social situation anxiety. We've also got panic attacks and panic disorders. So it's when the severe feelings of anxiety arouse in specific situations, and those can be as varied as we are as human beings, but there's a very specific trigger to the anxiety that's related to one experience that we are anticipating having, and people get that overwhelming panic attack in response to a specific. They also come in here a bit, really, is because we've also got phobias, specific phobias that can trigger anxiety. And again, that could be a very broad field even. So a kind of quite common one really is fear of spiders, snakes, aeroplanes, thunderstorms. But it's a very specific trigger that creates that. And we're talking about a phobic response. So people have an anxiety attack in response to the stimulus, or imagining the stimulus. We don't actually have to be exposed to it. Agoraphobia is another one that also comes under the anxiety disorders. And I think many of us can probably relate to that at some point in time. Home is your safe space. You feel safe and comfortable there, and actually going outside, whether it's among people or not, can be a bit overwhelming sometimes. Agoraphobia to its extreme is obviously people who are unable to leave home at all, or can't do so without a crippling level of anxiety. what else have we got? And then we have the post-traumatic stress responses, which also come under anxiety disorders. So that is reliving trauma in response to a specific trigger that reminds people of what happened. And again, the symptoms people experience and report with trauma are very, very similar. The racing heart, the restlessness, the sense of impending doom, but it's related to a specific life experience that somebody had in the past. So those are them. Quite a bit of stop thought. Realise the obsessive compulsive disorders sometimes come into the anxiety category as well. I think often anxiety disorders can be misdiagnosed as OCD because you've got the ruminations and a sense of impending doom that go with both. So that's how it's broken down in terms of diagnosis. So anybody seeing a mental health practitioner for anxiety, they'd be looking at what kind of anxiety do we have here? Does that impact on the kinds of treatments that might be?
Yeah, and I think what's really interesting about that for me is that some people can have anxiety and all these symptoms, but there's no cause. It just is, like you said, that genetic component or maybe hormonal component.
Yeah, and I think as human beings, I always like to think, I think we should be about 20% anxious all the time. And I think that's the primal brain, because actually we are vulnerable to attack by bigger animals with stronger claws, with teeth. We would potentially in the wild be prey. So actually it's a survival mechanism. And we tend to think of anxiety as being a bad thing, but actually anxiety is a stress response, and no stress is as bad for us as too much stress. So I think we've got this 20% arousal to anxiety, which is there to warn us if there's something dangerous or risky that we need to fight or flee from. As we don't live in caves and we're not generally prey in the same way anymore, that anxiety then has to go somewhere, because the system is aroused, it's vigilant, even if it's turned down quite low. And so I think it can get displaced sometimes into things we don't need to be as anxious about as we become. If we look at it with our rational mind, we think, I can't really understand why that's making me feel so anxious. But I think we've got a biological level of anxiety we carry all the time.
That's interesting, isn't it? It's that, like you say, that stuff around acceptance, radical acceptance is really interesting, isn't it? It's accepting that what we are as human beings, what that actually means and how we live with that.
And even though we live in the society we do and the modern lives we do, of course, that's not our origin. So there's primal parts of us that we're perhaps not aware of that have a very real survival function.
Yeah. Okay. And so what type of interventions would you recommend for people struggling with anxiety?
Well, there's quite a wide range, really, which is good because no one size fits all. Anxiety is a very, very physical experience. And for most people, the physical is the overwhelming bit, and that triggers even more anxiety in the thought processes. Quite commonly, people feel they're going to have a heart attack. They worry that they might pass out through too much or not enough oxygen. So it's a really embodied experience. And absolutely, if there's one bit of magic with anxiety, and it sounds really very simple, because on one level it is controlling breathing. Because what we do when we get anxious is we start to hyperventilate. So we breathe very shallow from the top part of the chest, and not lungs extend all the way down into the base of the abdomen. So we're taking quick, shallow breaths, which means we're not getting enough oxygen to really help our thinking processes. So the thoughts are spiraling more and more out of control and becoming more and more catastrophic. If we control the breath, we increase the rate of oxygen to the brain, and we slow that internal, I always think of it as the mind is like a wild and restless horse. And it's hot, it wants to be out of that stable door, it's frightened and it wants to go, it's thinking something catastrophic. And we need to put strong reins on it. We have to pull it back in so it doesn't hurt itself. So breathing really is the key to doing that. And I always say to people, don't worry about breathing in. There's lots of breathing exercises where they say, breathe in for a count of 6 or 8, hold for 6 or 8 and breathe out. We never forget to breathe in. We often forget to breathe out. So when we're worried, we go, so we breathe in, but we're holding it. And of course, that's the lack of oxygen again. So the really important thing is to concentrate on breathing out. And breathing out to a count of 6 or 8 is really good. Doing that 10 times means that the physical body cannot start into the anxiety panic spiral in the same way. And that then gives us the opportunity to make a choice about what we do next, rather than it becoming a chance. You know, panic makes us do things chance. I'll try that, I'll try this. Controlling the breathing allows you to make a choice about what to do. So for me, that is the bit of magic, controlling the breath. Once we've got the breath under control, we can make some choices about what we do. And one of the things I will send to you, Steph, so you can email to the group, is I've got a really good workbook that gives lots. I didn't write it, I can't claim that, but it is freely available for use in therapeutic intervention. And there are a whole range of techniques in there, because everybody's different and every day is different. So what works for me on one day in one situation won't always work. We need to have a repertoire. So one of the first things is saying to ourselves, this is an anxiety attack, naming it, knowing what it is, thinking, what is it I need to do now? Do I need to do something to distract myself? So do I need to go for a walk? Do I need to do something creative that absorbs my mind and keeps my hands occupied? Exercise is a really good key, because again, anxiety is very physical. The tension is in the body, so anything we can do that helps get the tension out is really healthy. So walking is really good, but any form of exercise, swimming, dancing around your living room to some really loud music, just not holding the tension physically is really important. Asking for help, I always think, is really important as well. I think it's really hard to do when people sit with the fear, but actually phone a friend. Phone someone you can trust and say, I'm struggling right now. Having a conversation. Again, it's about externalizing it, not just trying to hold on to it and hold it in and control it, but actually say, I'm feeling anxious, I just need to talk it through, is really good. Getting good sleep is really important. You know, the more we pay attention to our sleep hygiene and having good bedtime routines, the less likely we are to suffer from quite the same level of anxiety, because we're rested. And when we are anxious, the cortisol system in the body, which is again very primal, very high adrenaline, is almost ready to switch on, slightest trigger. So if we're not sleeping well, we've got a high level of cortisol being released, which means we're more likely to have an anxiety attack or experience anxiety generally. So sleep's a really important one. I would say, I think it's really important people give their worries time. What we tend to do when we are frightened of something is avoid it. And when we're working with people with anxiety disorders, one of the first things we have to get them to do is to face the fear. Because the fear is there anyway. The more you avoid it, the more frightening it becomes. So the more you try and avoid it, so the more frightening it becomes. So it's a vicious cycle. And it's actually about acknowledging what our worries really, really are, writing them down, talking them out with other people, actually naming them very clearly. And then we can do a bit of a, reality test with it. How much do I need to be worried about it really? Because some of those things are our real and genuine worries, and it's really important to give them time. I've often suggested to people that they actually have an allocated time of the day or day of the week where that will be worry time. And so if a worry comes up at any other point, you can say to yourself, until worry, that's all right, I'll get to you, but I'll get to you on Tuesday afternoon at 3:30, because that's my worry time.
Brilliant, I love that.
And it's about not trying to deny our worries is really important. And I think often we do that, as human beings. It's like, I don't need to worry about that. And telling yourself you don't need to worry about something doesn't stop it, otherwise my job would be really simple. Just saying, I don't need to worry about that, I'll park it. Actually saying, I'll give that some time, and I'll give it time when I can think about it and I can come up with some plans as to what to do, how to manage it. So I think money is a good example. Lots of us worry about money, and lots of us have some real and significant money worries. But to allow them big spaces in our day every day is really quite crippling. And to say, well, I have this. Sorry, excuse me. I've done that beforehand. Is that to allow ourselves one point in the week where we actually do focus on those things and find solutions, which could be, sometimes we can have quite small solutions to money worries. It's like, well, I'll just spend a bit less on this. Sometimes our money worries might be really quite big and quite disabling, but it could be about, I'm going to approach Citizens Advice Bureau to ask them for some help in getting help with this. But rather than it being a thing that we allow into our life all day, every day, we say, I'm going to look at that at this point in time. Solutions is quite important, because when we're anxious, we can't think of a solution in the moment. Yeah. So solutions are things we need to think about when we're not anxious, and write a really big list. And that could be solutions to the practical things. What can I do to reduce the things that make me anxious? Reduce the frequency, reduce the intensity. They can also be about, what do I do when I feel? So that in the moment, you're not trying to find something to do to feel better. You've already got a list, and you can decide which ones in which situations. So like I said, I'll send you a workbook to send out, because there are hundreds of ways of responding to anxiety, from the very cognitive, which is about looking at our thoughts and challenging our thoughts, to the very physical, doing something to get rid of the anxiety in the body, to much more. I've in my time in psychology seen our framework really embrace the Eastern, so things like mindfulness, which actually are really good for anxiety and depression. That being present, being in the moment, focusing the attention on something that isn't the internal state. There are lots of visualizations, so we're all different. People tend to be either visual, so they see things, they visualize things, they will express things in terms of the color, the tone. Some people are very auditory, they hear things, and some people are very kinesthetic, they feel things, they embody things. So finding a strategy that fits your personal type is really, really helpful. So if you're somebody who visualizes things, you have a very active imagination, you could think about what color is the feeling. This works really well with pain as well. What color is it? And then change its color through the spectrum. So if it starts red, it's really hot, it's really intense, it's really vibrant. You can tone it down. You can imagine almost like turning the dial on the speaker, but moving it through oranges, through yellows, through to greens, through to colours that are more calming and soothing. And you can do the same with the soundtrack, either in your head or literally play music. What matches how you feel at the moment? How would you like to feel? I used to get people to do mixtapes and CDs for me. That's how old I am, you can tell. I'd say, actually, and this was what I'd use with anger as much as anxiety. What's the soundtrack when you feel like that? And it would be loud, it would be aggressive, it would be discordant. How do you want to feel? And pick a track that feels that way. And then create a soundtrack for yourself that moves from that high intensity, really unpleasant feeling to the feeling you want. So you're turning the volume down, changing the volume. So those things work really well for people. And again, it would work with a feeling thing, an aesthetic thing. So you might do something really intensive physically to get rid of that energy, that really pent up energy, but then you can reduce the intensity of it. So I always think, I'm a yogi, as you know, I really enjoy my yoga. If I am in a 10 out of 10 state of anxiety, I am not going to be able to sit on my mat in stillness and feel peace. I'm going to have to match the activity I do to the sensation that I already have, so it's going to be quite intense. I might do yoga as a preventative measure, and I might do it if I'm somewhere around 5 out of 10 on the scale, but I wouldn't try if I was 10 out of 10 restlessness, can't sit still, because for me that wouldn't work, and it might work for some people, but it's about matching what you feel to what you feel, but externalizing it, representing it in some way in your world. Sometimes we can actually talk ourselves out of our thoughts, by acknowledging what that thought is and then reality testing. So it's all going to go horribly wrong. I will lose everything. Breaking it down. Go horribly wrong because of what? What's the evidence that here and now something bad is going to happen? That works for some people. I have to say it's not been a great success for me. I'm a very kinesthetic person, and I know what I need to do is physically move. And I have been through a period of my life where I used to have full-blown panic attacks that were very related to a specific situation, and I needed to move. I literally couldn't sit still, but I would walk. I would walk really fast and uphill until the breathlessness was a purely physical thing. And I would keep walking until my walking was slowed and I was enjoying the pace and I felt calm. And that's what worked for me. And everybody needs to find a strategy for themselves, really, based on, knowing yourself as you are. So that's why I'm saying I'll send a book, because there's so many in there, from mindfulness exercises, creative visualization, suggestion of actually practical things to do when you feel.
Yeah, that's brilliant. Thanks, Helen. That's great. And that means that probably in next group what we'll do is we'll look at, do we think that visual, kinesthetic or auditory interventions are going to work better for you? And I'll get them to practice that over the next couple of weeks so they can figure out which ones that will help in terms of grouping them.
That's a really good idea. And what I would suggest is we can tell by the way people speak, whether they say, I see what you mean, I hear what you're saying, I feel this, is a big indicator.
Yeah, definitely. People cannot not communicate. It's in there, isn't it?
Yeah, that's what we're driven to do.
Yeah, that's great. That's brilliant. Thank you so much, Helen. There's some really great information in there that backs up the work we've been doing already. So that's fab. I think you sent me through the book.
Dealing with distress one, did I send you that?
Yes, which I have shared with the group, and the group loved it. So that's great. So this will top up that. Thank you so much for today, Helen. That's great. I'm sure people will get a lot out of that. Anxiety can be quite difficult, particularly you can get caught in a loop with the drinking, can't you, and the anxiety.
Yeah, and actually we do know that people who become problematic drinkers often were socially anxious, particularly beforehand. I think it's something like 2/3. It's really quite high. And of course, alcohol reduces anxiety in one way and then increases it in another. And it's stopping that, just giving yourself time to stop and think and space, isn't it? To make some choices rather than chances. And what I would say, Steph, is if people have specific questions that come up for them following on from today that they want to kind of pose, that you can email those to me and I will get back to you. That would be absolutely fine. It's a lot of information.
Yeah, that's great. No, that'd be brilliant. And we're talking, I think, in a couple of weeks, so I can bring the questions to our meeting. That's great. Thank you so much, Helen. I'll see you soon.
Thank you for having me. See you soon.
Bye.